Good afternoon. See people coming into the webinar space. Thank you so much for joining us today. You're here for the HPIO webinar, Promoting ACEs, Protective Factors, and Supporting Ohio Families. My name is Haley Aka. I'm the Vice President of Operations and Strategy at HPIO, and we're so glad to have you with us this afternoon. HPIO is an independent and nonpartisan organization. Our mission is to advance evidence-informed policies that improve health, achieve equity, and lead to sustainable healthcare spending in Ohio. On the next slide, I'll just take a minute to thank our core funders who advance our mission with their steadfast investment in our work. We'll also give a special thank you to the Ohio Center of Excellence for Behavioral Health Prevention and Promotion, who is the presenting sponsor of this year's educational event series. And on the next slide, you'll see the rest of our educational event series sponsors for 2024. Thank you all for your generous support of our events. This is the last educational event. You can go back there. This is our last educational event for the year. Thank you all for a great 2024. We look forward to more opportunities to connect and to learn together in 2025. If your organization might be interested in sponsoring our 2025 event series, including our statewide health policy summit, we'd love to have you join us. So feel free to reach out in the question box in the chat. You can email me, go to our website and find my email. We would love to connect with you. All right, on the next slide, we're going to have a little time during our hour together today to answer questions from you all. So as our speakers are presenting, please feel free to type any questions that you have into the chat or the question box. We'll address them out loud as time permits, and we'll also be answering questions in the chat itself. We're also going to have a couple poll questions throughout the event today, so thank you in advance for responding to those polls. Today's presentation slides and other related resources are available on the HPIO website, and that can be found by going to hpio.net or healthpolicyohio.org and clicking on our events tab. We have a full agenda today, starting with an overview of some recent analysis from my HPIO colleagues, Becky Carroll and Jacob Santiago. And we're going to hear also some policy and program updates from both the Ohio Children's Trust Fund and the Ohio Department of Education and Workforce. But before we do that, I'm going to spend just a couple of minutes sharing a bit of background on adverse childhood experiences, sort of ground us in the content for today. ACEs, adverse childhood experiences, are potentially traumatic events that occur during childhood. Research evidence is clear that ACEs exposure is linked to poor health and well-being through adulthood. And generally, the more ACEs that a person is exposed to, the greater the risk of those poor outcomes. On the next slide, we'll see how foundational research has grouped ACEs into these three categories on the slide. That's abuse, household challenges, and neglect. However, there is variation among researchers on what is considered to be an ACE, and newer research has expanded this list to include things like community violence, experiencing homelessness, and experiencing racism and other forms of discrimination. The ACEs here on the slide have been the focus of our work at HPIO over the past several years, and the analysis that you'll hear more about today. On the next slide, ACEs are very prevalent in Ohio and across the country. In 2021, 69% of Ohio adults reported exposure to one or more ACEs during their childhood, and 47% reported two or more ACEs. Next slide. We also know that some groups of Ohioans experience ACEs at higher rates than others. This bar chart shows how prevalence of two or more ACEs is different across different race and ethnicity groups. Black, non-Hispanic Ohioans are the most likely to have been exposed to two or more ACEs in Ohio. On the next slide, we see ACEs across different income groups. The likelihood of experiencing 2 or more ACEs goes down as income goes up. We also see higher rates of ACEs among children with special healthcare needs and children living in foster care or with kinship caregivers. We're going to end with just a little bit of data on the health impacts of ACEs. This slide shows smoking rates by number of ACEs. We see that Ohioans who have been exposed to at least 2 ACEs are almost twice as likely to report being a current smoker as Ohioans who have no ACEs exposure. And on the next slide, we see that those exposed to 2 or more ACEs are more than 3 times as likely to report having depression. These are just 2 examples. There are many other impacts, negative health outcomes of ACEs, outcomes that have been linked to ACEs exposure. With that little bit of background, I am now happy to introduce my colleague, Becky Carroll. Becky is the Director of Policy Research and Analysis at HPIO, and she's going to talk through our recent work on protecting against the harms of ACEs. Thanks, Becky.
Thanks, Haley. Hi, everyone. Thanks so much for being here with us today. I'm going to start by introducing you to this very important concept of protective factors. And all of the information that I'm going to be speaking on today comes from our brief entitled Protecting Against the Harms of ACEs. Next slide, please. Of course, ACEs can be traumatic, but the harms associated with ACEs are not inevitable. Protective factors are positive experiences, resources, or assets that can buffer children and families against the harmful effects of ACEs. Protective factors are also associated with improved health and well-being and are really valuable for all people throughout life. On the next slide, we see that protective factors exist at the societal, community, interpersonal, and individual levels. And protective factors at all of these levels are important, especially for those who have experienced multiple ACEs. I'll be talking through each of these levels during my presentation today. But first, I'd just like to mention that when we are thinking about preventing and mitigating the impacts of ACEs, we want to focus both on promoting protective factors and also on reducing risk factors. And this slide gives a few examples of each. Next slide. So to begin, this slide lists protective factors at the community or societal level that we describe in the brief. Supportive communities with access to needed resources enable children and families to thrive. First is economic opportunity. Next slide. This includes factors such as a sufficient income, employment, and stable housing. When these basic needs are not met, it's much more difficult for families and children to thrive, and for parents and caregivers to provide a nurturing and supportive environment for their kids. My colleague Jacob is going to be diving deeper into these concepts in just a few minutes. We see another example on the next slide of a community level protective factor, which is access to quality and affordable medical care, medical homes, and any needed mental health services. Next slide. Safe, supportive neighborhoods are another example of a protective factor for children and families. This means neighborhoods in which people have relationships and look after one another, where there's a sense of solidarity and people are willing to intervene on behalf of the common good. This is defined as collective efficacy. It tends to be more challenging to develop collective efficacy in neighborhoods characterized by economic deprivation and residential instability. This picture is from an organization in Athens County, Ohio. Next slide, we see that schools in which children feel physically, mentally, and emotionally safe and experience a sense of belonging can be protective against the harms of ACEs. A positive school climate is one where there are strong, positive relationships between students, teachers, staff, and families that foster trust and support. Also, where the academic and disciplinary environment of the school promotes learning and student wellness. This is a picture from Toledo Public School webpage about school culture. And we'll be hearing more about this topic from one of our speakers later in today's webinar. So switching to the next slide, we'll start talking about interpersonal level protective factors. Both family and non-family relationships are important protective factors and are essential for the overall health and well-being of children, and really for all people throughout life. Having an adult such as a parent, grandparent, or other caregiver that makes a child feel safe and takes care of their basic needs is a critical protective factor. Research shows that children exposed to 4 or more ACEs who grow up with these nurturing relationships actually have better mental and overall self-reported health. An HPIO analysis of Ohio level data also confirms this. Next slide. The data on these next few slides is from the Behavioral Risk Factor Surveillance Survey. These charts show the percentage of Ohio adult respondents who said they had a caring adult in their home who made them feel safe and protected. And then on the right, who made sure their basic needs were met. And we've broken this data down based on the number of ACEs experienced. Unfortunately, here we see that those Ohioans who reported more ACEs exposure were less likely to report having these types of caring adults in their home during childhood. Next slide. However, our analysis showed that having a safe and caring adult at home mitigated those negative health impacts of ACEs. This slide shows that those who experienced 2 or more ACEs were much less likely to report smoking and depression as adults if they had an adult who made them feel safe and protected during childhood. So for example, of those who experienced 2 or more ACEs and reported having an adult who made them feel safe and protected, reported never having an adult who made them feel safe and protected, or having this type of caregiver only a little bit of the time, 49% reported having depression versus only 26% of those who reported having this type of caregiver all of the time. And the slide on the next, the chart on the next slide is very similar, but shows smoking and depression rates based on how much of their childhood people reported having an adult in the household who tried hard to make sure their basic needs were met. Again, we see the lowest rates of those negative health outcomes among people who reported having this type of caregiver all of the time. These findings demonstrate the importance of these critical relationships and suggest that improving a parent or caregiver's ability to provide for and protect their kids gives children a strong start in life and can improve overall population health in the long term. Stressors and adversities experienced by some parents and caregivers, however, such as living in poverty or lacking access to safe and affordable housing, can undermine their ability to provide this secure, healthy, nurturing family environment. Next slide. Supportive relationships outside of the family, such as with teachers, neighbors, mentors, or peers, can also be protective and support well-being. Unfortunately, we see here in 2021, only half of Ohio high school students reported they felt that they were able to talk to a friend about their feelings. And then students with 4 or more ACEs were quite a bit less likely to report having a trusted adult or friend to talk to compared to students with no ACEs. Next slide. There are additional protective factors within a school setting, including feeling close to other students, feeling a sense of belonging, and participating in school activities, such as extracurricular activities. However, we do see disparities in access to extracurricular activities with children from low-income families having much lower participation rates. Two possible reasons for this could be transportation barriers or fees associated with participation. Next slide, please. Finally, certain individual skills can also contribute to improved well-being throughout a person's life. The skills and competencies listed here have evidence of being effective individual level protective factors. They foster resilience, which is the ability to successfully and positively adapt to challenging or threatening circumstances. The ability to develop these skills, however, largely depends on the existence of those interpersonal and community level protective factors described before. I'll also add that children who've experienced ACEs and trauma tend to have more difficulty building these individual level protective factors, partially due to changes in the brain caused by trauma. Next slide. Training on how to build these critical social, emotional, and problem-solving skills can be integrated into K through 12 education or during out of school time activities through social emotional learning. Next slide. This brief also includes evidence-based policy options to promote protective factors at the community, individual, and interpersonal levels. And as Haley mentioned, we're very excited to have speakers joining us from the Ohio Children's Trust Fund and the Ohio Department of Education and Workforce to talk about some of their organization's work to promote and build protective factors for Ohio children and families. But first, my colleague Jacob will be talking about the very important protective factor of financial security.
Thank you so much, Becky, and good afternoon, everyone. It's great to be with you all today. As Becky said, I will be walking all of us through how economic opportunity as a community level factor impacts ACEs exposure and overall health and well-being. And these findings are from HPIO's recent Financial Security and Health Brief. And so this next slide was shared earlier by Haley. I thought it was important to elevate it again to reinforce this connection between incomes and ACEs exposure. It helps make the case for public and private leaders to invest in the financial well-being of families so they not only have the support they need overall, but are also able to break cycles of trauma and poverty. Next slide. And with that in mind, this brief, completed with funding from Nationwide Children's Hospital here in Columbus, was focused on how financial security impacts the health and well-being of children and families and can affect ACEs exposure. To that end, we wanted to do the following. We wanted to include some data and information on how financial insecurity affects and intersects with health outcomes and the other social drivers of health. We wanted to include some perspectives from community. Then we also wanted to elevate strategies that public and private leaders could use to support financial prosperity and prevent childhood adversity. Next slide. From that, we learned that there is a bidirectional relationship between financial health and other social drivers of health, like housing and education. And both of them, together and independently, affect health outcomes through increased exposure to toxic stress and ACEs. All the while, they are undergirded by systemic challenges and barriers to good health, like stigma and racism and other forms of discrimination. On the next slide, we have this framework called the Pair of ACEs, and it helps demonstrate how adverse community environments like poverty and a lack of economic mobility lay the soil for adversity in childhood. This means that when Ohio communities do not support the financial well-being of families, the risk of ACEs increases. Next slide. We know that many Ohio families are not earning enough to afford the basics like housing and childcare and healthcare, but they earn too much to receive any kind of government assistance. And 40% of families, regardless of their ability to receive assistance, are not earning enough to afford those basic necessities. let alone to spend money on any quote unquote luxuries. One key informant we interviewed described how that gap between income and financial need meant that her and her husband needed to make some choices about where their money was going to go. And so they decided to cut childcare cost, and she would work part-time to take care of their children, and he would work multiple jobs to kind of fill in that gap. Next slide. We see that same sentiment come across when we look at how wages compare to what an Ohioan would need to earn to afford a two-bedroom unit here in Ohio. So an hourly wage renter would need about $21 an hour to afford a two-bedroom apartment here in the state, but many occupations and even Ohio's minimum wage aren't meeting that need. And while many are told that higher education leads to financial security, for many, that's not their lived reality, as described by one key informant. Next slide. We also saw considerable differences in rates of financial insecurity across the state. Ohioans living in Appalachian counties were more likely to experience poverty, and our ACEs work has highlighted that Ohioans living in these counties are also more likely to report having been exposed to multiple ACEs. Next slide. One thing that rose to the top of the research and was also echoed by our key informants is that many parents with lower incomes have faced barriers to financial security and prosperity, including exposure to adversity in their childhood. And they can face additional barriers to providing a supportive environment for their children, as Becky described, often because of their ACEs exposure. Nevertheless, they can and do still provide a safe, stable, and loving environment for their children. Both key informants expressed that the children in their care are a priority for them and that they have a vested interest in their well-being. Next slide. Like with all HPIO work, we included an extensive list of strategies that public and private leaders across Ohio could implement to improve financial prosperity and prevent ACEs exposure. We bucketed them into the groups on the slide. I'll mention two examples. One is a little bit more policy-based, the other is a little bit more programmatic, which will tie nicely into our first guest speaker's presentation. Next slide, please. Families receiving temporary assistance for needy families, TANF, also known as Ohio Works First here in the state, are required to assign their rights to child support to their state to receive TANF benefits. States then have the choice to pass all or some of that child support through to the family, or they can keep it to reimburse the federal government. They can also disregard any passed through amount of child support when determining a family's eligibility for TANF. As of May 2023, Ohio was one of 24 states that did not pass through child support to families receiving OWF benefits. However, the evidence finds that states that pass through and disregard the full amount of child support can increase income and decrease child maltreatment. They can also reduce disparities with these types of policies. Next slide. Lastly, financial services like coaching and free tax preparation support participants' financial health and prosperity. One interviewee expressed that the financial relief they were able to gain through the free tax assistance clinic at Nationwide Children's Hospital was extremely helpful in stabilizing her and her family. And one of our speakers will talk a little bit more about a specific financial service in our state. But before we get to that, I want to pause and see if there are any questions.
Thank you, Jacob. Our team is answering some questions in the chat. I wonder, Becky, if you would like to pop on and answer Tara's question about the impact of COVID on the ACEs data. answered it in tech, but maybe it would benefit the whole group as well.
Sure, absolutely. We weren't completely sure which data point Tara was referencing, and we can't immediately get data for everything that we are shared, but we did look into whether high school students felt they had a trusted friend. That number actually went down just a little bit from 21 to 23. And then for having feeling like they had a trusted adult to talk to, the percentage did go up to 45.3% in 2023. So it went up about 2 percentage points from 2021.
Thanks, Becky.
And Tara, if you want more specific data, you can reach out to us later.
Tara said in the Q&A box that is the exact data point that she was interested in, and thank you for looking that up quickly for her and for all of us. Okay, well, with that, Jacob and Becky, you can head into the chat and see if there are any other questions. You can chat them live. Thank you guys so much. At this point, we're going to throw our first set of poll questions. Jasmine will take care of that for us. There we go. Just a couple here. Thank you for providing us feedback. It helps us plan events. We really do utilize the feedback that you give us. And you're always welcome also to type things into the chat about things you'd like to see from HPIO events or feedback you have for us on this one in particular. As you all answered that, I'll just take a minute to introduce our first guest speaker, who's already popped up on the screen. Thank you so much, Nicole. We are grateful to have Nicole Silliman with us this afternoon. Nicole is the Executive Director of the Ohio Children's Trust Fund, which is an agency that works exclusively on supporting families and preventing child maltreatment. And she's going to describe how the Children's Trust Fund works to build protective factors among families to prevent child abuse and neglect. With that, thank you. Thank you so much for being with us, Nicole.
Thank you, and good afternoon, everyone. Glad to be with you today. And you can go to the next slide, please. And to the next one. So first I want to introduce who the Ohio Children's Trust Fund is. A lot of times people are not quite familiar with us. We are one of the governor's boards and commissions, and we are housed within the Ohio Department of Children and Youth. The mission of the trust fund is to prevent child abuse and neglect through investing in strong communities, healthy families, and safe children. We are designated as Ohio's state lead for community-based child abuse prevention, and we also hold Ohio's chapter for Prevent Child Abuse America. Next slide. And statutorily, we are dedicated exclusively to funding and supporting primary and secondary prevention. And we talk a lot, and I'm sure, for those who are on this webinar with us today, you probably are familiar with hearing about going upstream, going downstream. And so when we talk about the work that we do at the Trust Fund, we like to use this visualization just to differentiate between upstream, downstream, all the different levels of prevention, because we throw around a lot of different terminology. So as I mentioned, it is in our statute that we fund only primary and secondary prevention. And for this purpose, that means that we support programs designed to prevent child abuse and neglect from ever happening. When we think about tertiary prevention, that's when we're talking about preventing the reoccurrence of abuse and neglect after it's already occurred. We use this visualization to show that primary prevention is our universal approach, offering services that reach the largest number of individuals without a targeted response where everyone receives the same service and has this access to the same services. So that's your bridge. And so we want as many people accessing the exact same service when we're thinking about primary prevention. Secondary prevention describes those services that have a more targeted approach. We're looking at trying to help families that may have a certain risk factor that we're trying to address, and it's a much more individualized approach. And then finally, as I mentioned, tertiary is when we're going downstream and we want to prevent the reoccurrence of maltreatment. Next slide. And so, our philosophy around child abuse and neglect prevention is grounded in the Center for the Study of Social Policy, Strengthening Families' Protective Factors framework. And you heard Becky talk about this a little bit when she was reviewing some of the protective factors at the state level. And so really what we're doing at the Trust Fund by utilizing this framework is really kind of buffering our families under that umbrella, building up their protective factors while reducing their risk factors. The framework focuses on positive ways to engage families by emphasizing their strengths and identifying what parents and caregivers are doing well, as well as identifying areas where families have room to grow with support. There is a whole body of research that shows that a family's ability to build up their protective factors actually helps offset their risk exposure and contributes to both short and long-term positive outcomes. We know through our programs, we cannot always address all of a family's risk factors, but through our services, we equip the family with as many parenting tools in their toolbox, that's our protective factors, so that they have a buffer when they are exposed to risk. A big component of our work is highlighting that just because a family has risk factors doesn't mean that will predict a future negative behavior, because we know that protective factors can offset those risk factors. Next slide. And so through this framework, there are 6 key protective factors that we're looking at in relation to child abuse and neglect prevention. And we want to see from families as they engage in our services. And these services, they include things such as home visiting program, evidence-based parent education programs, after-school programs, mentoring programs, just to name a few. We want to see that their protective factors are increasing. And that is what we have been measuring at the Trust Fund in relationship to the services that we fund. And so we're looking to demonstrate improvement in outcomes, as well as thinking through behavior changes in relationship to parenting practices. And this may be things such as decreased use in harsh discipline tactics, better connecting to community resources when a family is in need, feeling connected to one's child, bouncing back from hardship. All of these items are tied back to protective factors, which is our primary focus for making improvements in parenting, improvements in families' lives. Next slide. And then recently, we have been having even more conversations, and I know this is very text heavy, and I know you'll get these slides after, about how do we drill down into these specific outcomes under these buckets of protective factors. And so that's something that we've been focusing on through all of our different parent education programs and parent cafes and our childhood focus programs, is how do we get down to those specific behavior changes to then measure our outcomes. And so we found some additional tools that we're going to be introducing to our partners in addition to the protective factor survey to really measure those kind of sub behavior change outcomes that tie up to these larger kind of systems level protective factors, so that we can really show the improvements that we're making in families' lives. Next slide. And so specifically, that is how we talk about the Trust Fund and Strengthening Families framework from an agency standpoint. And now we're going to dive a little bit deeper into one of our programs that shows what this looks like at a programmatic level when it's applied to families. Next slide. And so we're going to talk through the Family Success Network today. And this is a model where we received a federal discretionary grant a couple of years ago to build up a pilot. And it has really taken off, and we have been able to expand it over the past couple of years. And so the Family Success Network is a voluntary program designed to strengthen and support families based on their unique needs. And we provide a whole range of services and supports, such as information referrals, parenting support, financial literacy, and I'll talk through a little more details in a subsequent slide. But the gist of this program and what you're going to see as I talk through some of the details is it really is grounded in many of those protective factors and making those core components of the program, really kind of bolstering family strengths as we have our family coaches work to address the needs of the families. We have been able to expand. We're in 12 Ohio counties right now. And then each of our counties has an implementation team that really focuses on specifically what's happening at the community level, building up those connections and those referral sources. Next slide. So this is a little bit more in the weeds pertaining to the specific service array. I had already mentioned information and referrals as part of, if a family has some additional needs such as substance use, mental health concerns, we want to make sure we connect them to the appropriate treatment facilities and centers for those. But another piece that we provide is both financial literacy as well as concrete supports. You just heard Jason talk about, or Jacob talk about the importance of really elevating and supporting families' economic needs. And so that is a big component of this as well. We are able to provide $500. We know it's not a lot, but $500 to support something like a utility bill, rent, a car payment, kind of whatever the family needs to address that economic concern. But we do couple it with a financial literacy course through Money 101. And then we want to make sure that we're focused on supporting the parent skills. So we have parent education through different levels of Triple P. We have our family coaches trained in basic life skills, really helping our parents understand futures planning, goal setting, really thinking through how do I plan for the future. And all of this is provided through family coaching. Next slide. This is just a visualization of how families come into the program. We wanted to have a centralized person who is our program manager, who then is able to identify the needs of the families through different referral sources, and then they assign the family to a family coach. And that family coach is able to offer all of those different programs and services as part of that beehive, really dependent on the needs of the family. So it's going to look different based on what that family is looking for. Next slide. Just some key data and some recent wins. We wanted to show that we have been growing, and the need for our families is growing year over year pertaining to how many referrals we're receiving and then how many families we're serving. Also, we wanted to call out that a little over 70% of our participants from the last state fiscal year reported improved access to tangible goods and services in times of crisis. So measuring that concrete supports and that data piece is a key one of our outcome measurements for our program. Next slide. And then just thinking through what we're seeing with regard to the families that we're serving, approximately 70% of participating families reported incomes less than $35,000, with 30% of families reporting incomes of less than $10,000. So really showing that we know that we're working with families who have heightened risk factors as it relates to income and their ability to access services. Next slide. And then housing. Housing continues, and I know this is true across the state, continues to be a hardship for many of our families, with 50% of our participants reporting renting their homes, nearly 10% reporting living in temporary homes such as shelters. So housing continues to be one of our top concrete support needs as well that we receive requests for. Next slide. And then just real quick, a couple of key evaluation findings. I won't read all of this, but we are seeing statistically significant differences in our outcomes related to nurturing and attachment and concrete supports. And you can go to the next slide. And the other thing that we're seeing is statistically significant outcomes as it relates to the relationship between our family coach and the parents. And then we're seeing even more relationship with outcomes improving for protective factors when we see the stronger relationship between the family coach and the participating family. So really showing that our family coaches are the drivers of change and improvement of protective factors. And so it's been really exciting to kind of grow this model and see the impact that it is having across the state. Next slide. And I think I used up all of my time, but I am happy to answer any questions. And I know on the very first slide, I also had my email. So feel free to reach out to me if you have any questions.
Thank you, Nicole. There are a couple of questions in the chat and in the Q&A box, so I'd invite you to go there. I will ask just maybe one or two out loud before we move on, if that's okay. We had a question about whether there's a goal to expand, I believe, the FSN program you described to other counties, and how folks could know the current counties that are being supported.
Yeah, so related to the current counties that are being supported, it was listed on one slide. I can try to, it's Cuyahoga, Summit, Stark, Columbiana, Mahoning, Trumbull, Lucas, Wood, Hamilton, Claremont, Brown, Franklin. I think that might be 12. But those are the current counties where we have the program. Related to expansion, we do have an opportunity coming up with actually Ohio Works First and JFS, where we're going to be expanding reach, not necessarily new sites, but expanding reach outside of possibly county lines with our current sites as part of that opportunity. We're a little bit out from when that would start. It would start next federal fiscal year, so we have a little bit of time for planning. But if somebody has a specific question where they want to learn more, they can feel free to email me and we can address those.
Great, thank you. One more question before we pop over. Again, there's a couple more in the chat, so if you have time to go there, that would be wonderful. But I'll ask this one out loud. What long-term outcomes are measured, such as future employment, health, chronic disease, substance use disorder, and how will this be accomplished?
That's a great question. We currently do not have those specific types of long-term measurements. What we are tracking, and we do have an evaluation for FSN, is specifically child welfare outcomes. And so we are tracking kind of subsequent contact with the children's services system based on participating in FSN. And so all of our data is really geared towards preventing foster care entry. We know that then as part of the ACEs is going to have impacts related to those other kind of long-term health impacts, but we're not specifically measuring that. We're measuring foster care entry, hoping to turn that into some ROI data pertaining to return on investment for prevention.
Thank you, Nicole. All right, we're going to transition now to our next speaker. As we transition, I'll just mention again, I'm seeing a couple of questions about slide availability, webinar recording availability. That will be posted on our hpio.net/events website shortly after today's event, either later today or tomorrow. Those will be available to you. And again, you can go to hpio.net, click on that events tab, and you'll see today's event. Becky has also posted that link in the chat for you all. So you will have access to the slides of the recording after today. Thank you so much for your engagement. All right. Great. So our final speaker for today, last but certainly not least, is Nicole Kaler, who's mental health consultant with the Office of Whole Child Supports at the Ohio Department of Education and Workforce. Nicole's going to give us an update on some of the department's initiatives to build resiliency among students and foster safe and supportive school environments. So thanks for being with us, Nicole.
Thank you so much for having me. I'm very excited to be here. I see a lot of familiar faces in the participants. So hello to everybody that I know, and for everybody I don't, I hope you get something out of today's presentation. So slide, please. Next slide, it says questions. Maybe next slide.
I'm not seeing any slides in this version for you.
I will get started talking a little bit about the department, and then hopefully we can pull up some slides. If you need to pull mine up, let me know.
Let me check.
So my name is Nicole Kaler. I am a mental health consultant at the Department for Education and Workforce. I am also a social worker by trade. So prior to coming to the department, I did a lot of direct care directly in schools, and I managed a day treatment facility. One of the slides I had at the very beginning was just kind of outlining the 4 priorities that the department currently has for students that we serve across the state. So those are literacy, workforce readiness, accelerating learning, and student wellness. And all of those priorities are really interconnected. My team, which is the student wellness team, could really present a strong case that without student wellness, none of those could happen. But we also know that students must be healthy physically and mentally in order to be able to attend school and really reach their full learning potential. I also have a slide that outlines our office. So I work within the Office of Whole Child Supports, and this office focuses on providing districts, schools, staff, students, families with resources to support the whole child and really look at any of the barriers that are impacting academic success that are non-academic barriers. There it is. All right, next slide, please. That's the 4 priorities. So here's a picture of my office. The reason I want to include this is because some of the work that I'm going to be talking about includes other team members. So I focus on the school wellness team, but we also have safe and supportive schools and vulnerable youth. And you can imagine how those would all be interconnected to really make sure that our students are receiving all of the supports that they may need. Next slide, please. So I wanted to briefly just touch on and show our model for comprehensive school mental health for you all to see how schools are really set up to support students. And this is a framework that's built on the work and collaboration of district and school professionals in a strategic partnership with students, families, and community partners. So we need a lot of groups to work together to best serve our students. And so we know for some students, mental or physical health symptoms or knowledge of risk factors or trauma may first present at school. And so supports in school are really effective in reducing symptoms and risk factors, especially when they can be integrated with a team. This is partially because they're just a captive audience and they're going to be there, but it's also because of the ability to have the strong team of professionals from different backgrounds to support and monitor the child. So in Ohio, we really promote a full continuum of care. And you'll see at the very top is positive school climate, which was referenced during the earlier part of today's webinar. That's very important. But social skills, mental health and well-being, support for students and staff, and trauma-informed and restorative practices. And this is all put together because studies have shown that effective comprehensive school mental health systems contribute to all of those things on the second list. Reduced absenteeism, decreased behavioral concerns, improved school climate, and improved academic outcomes. And all of these things go hand in hand with promoting protective factors for students. Next slide, please. So the daily contact that schools have with children is really a unique opportunity for them to experience a variety of protective factors. Schools are environments that really can foster positive relationships, safety, belonging, teach social skills, provide supports and services that reduce barriers to learning. Not only are those factors important to having a positive school climate, which will lead to higher student academic success, but they're opportunities to build resilience in students. When students feel supported and cared for in their school environments, they can be less likely to participate in other problematic behaviors. And these students are also more likely to develop positive attitudes towards themselves and pro-social attitudes and behaviors towards others. So we know that children who have experienced trauma or adversity often have deficits in social and emotional learning skills due to chronic stress and the impact on their brain development. Teachers and other providers within the school counselors, social workers have opportunities to teach and develop these skills, such as fostering relationships, problem solving, and regulation. And we know that students must be regulated in order to learn and move lessons from their working memory to their short-term to their long-term memory. And these skills will also ultimately support academic success. So on the next slide, we talk a lot about being trauma informed within our schools. And I know Becky talked a bit about how being trauma informed can help prevent and reduce adverse childhood experiences and some of the harm that they cause. Again, schools are really in a unique position to support this. Trauma-informed schools create policies and practices and cultures that are sensitive to the needs of traumatized individuals. And I'm going to note students and staff. We're talking about everybody to really make sure that they're meeting their full potential. So examples on the slide are trauma-informed universal supports that directly connect to what research shows that the brain needs to both overcome adversity and build resilience. And all of these also overlap with a positive school climate. So building safe, supportive relationships are some of the most effective neurobiological interventions that can be done to build resiliency because it helps the brain stay regulated. And then when our students are regulated, they feel safe. When they feel safe, it allows them to learn and then practice new skills. Next slide, please. So I referenced my office structure earlier, and there's a lot of overlap between school climate and safety and vulnerable youth and school wellness. When our office works with schools and districts, this is a really good visual for recommendations on increasing positive conditions for learning. And a major area for our office and for the department currently is a focus on attendance. If you Google that, that'll be one of the first things that you will find as a priority for the state. And so while we've already talked about how schools can promote protective factors and offer supports to students, we also know that if schools offer a safe, welcoming, inclusive environment, students are more likely to attend school, and they are more likely then to have higher academic achievement. So if you look at all of the green circles, and I'm not going to go through all of them, but you will notice that they align with actions to increase protective factors for students. Can you advance it? It should pop up some more information on the slide, please. Go ahead and do it 3 more times. I didn't realize there was an effect. Thank you. So when I'm specifically, one more time, please. When I'm specifically meeting with schools and districts and I'm talking to them and I'm looking from the school wellness lens, one of the first things I ask are the basic needs of students and staff, highlight staff, being met? Because if they're not, when they come to school, learning can't and just won't be a priority. So what does that look like? Are basic needs being met? Do we have a way to support in adding to that? Potentially adding food, clothing, something that could support in enhancing basic needs. We also want to make sure that we're focusing on staff. If we want our staff to be building positive relationships to enhancing connectedness, we want them to be well and be able to best support their students. So do they have opportunities for self-care? A dysregulated adult cannot regulate a child. And do they have professional development opportunities? And are we making sure that we're building their competencies and handling difficult situations, or even knowing how to build social skills throughout the day? And then finally, restorative practices and circles for students and for adults. Restorative practices foster a sense of respect and empathy, and that's what's needed throughout the entire building. Next slide, please. So on this slide, we have a lot of different initiatives that the state is leading. Some of them, again, my specific team, some are overlapping with others. I will just highlight them very quickly, but if you go to our webpage, education.ohio.gov, and you search for any of these topics, you will get a much larger, higher, deeper level of information if you're looking for those resources. But the threat assessment training is a free training offered to schools and districts across Ohio to really focus on those less serious transient threats and supporting mental and behavioral health needs for students. Positive behavioral interventions and supports is a required framework in Ohio schools that guides school teams in the selection and implementation of evidence-based practices for improving academic, social, and behavioral outcomes for students. Becky referenced discipline as being an area that could be a protective factor, and this is supportive of that. In terms of prevention, all schools are required to provide education in suicide awareness and prevention, violence prevention, social inclusion, child sexual abuse prevention, dating and sexual violence prevention. And then finally, we do have a student voice work group made up of students throughout the state. While on their end, they receive leadership training and make connections with adults at the department, we also get to hear what they're experiencing and take that into consideration as we apply policies and resources. Slide, please. So for ongoing needs assessment, the state leads a coordinated youth survey effort led by the Departments of Mental Health and Addiction Services, Health, and Education. These youth surveys include the Ohio Healthy Youth Environment Survey, or OYES, as you may have heard it, the Youth Risk Behavior Survey, Youth Tobacco Survey, and School Health Profiles. These are voluntary surveys that offer a look into the experiences of youth in different communities and environments across Ohio, and they measure the frequency of behaviors and experiences that pose a risk to youth wellness and those that help protect it. So for example, it might ask about substance use, or there was a reference earlier to connectedness with an adult. So using these insights, we can really learn where Ohio students are thriving and then use that information to apply in other settings and expand on where we want them to grow. This is public facing data. If you go to that webpage and you can learn more about the state, it's also a survey year for OYES. So for anybody in the audience who is in a school or district, you will be able to see results in about spring 2025. Slide, please. And then in order to fund some of this, some school and districts may have some questions. How do we support our students? Under the leadership of Governor Mike DeWine in Ohio's General Assembly, Ohio dedicated $1.5 billion towards student wellness and success. And the funds primarily cover wraparound services that schools can provide to assist in promoting and improving the health and wellness of students. So the list on this screen is not inclusive. Just some relevant uses are listed. Slide, please. And this screen, again, if you go to our webpage for any of my schools or districts or anybody, community partners who are interested in how to tap into school funds, you are able to find out how much schools are allotted every year or biennium to provide for these services. And there's some examples as well of specific services that can be paid for through these funds, with also a note that starting this school year, at least 50% of student wellness and success funds must be used for mental or physical health services or a combination of the two. So again, if you go to our webpage and you just type in student wellness and success dollars, you will be able to learn about these funds, how they can be applied, how much your district may still have, etc. Slide, please. And then I know I noted that our website has a lot of information. We do pride ourselves on making it a living and breathing website. So if at any point you would like more information, there is a lot of different resources within our pages. You can type in the different topics I have here on the slide. They are hyperlinked once you have access to the slides to get more information. You can also always contact myself or anybody on my team if you are in need of any technical assistance or you have further questions. So with that, I will pause and see if anybody has any questions.
Thank you, Nicole. One question in maybe a minute before we wrap up today. Can you talk about the OES, the YRBS of the surveys and why those aren't required to be completed?
Sure. So in order for us to require a survey, it must be legislated. So we do have some surveys that are required. We do have a prevention services survey that goes out every year that schools must complete. But for it to be required, because Ohio is a local control state, it has to go through legislation. So we do make them optional. I agree. I would love more data around youth mental health. This is one of our biggest sources, which is why we have such a strong push for schools and districts to complete them and to encourage their students to complete them.
Great. Thank you, Nicole, and thank you for being with us today. As Jasmine pulls up our last sort of couple of slides to wrap up, I just want to remind everyone that the resources for today are at hpio.net/events. That's where everything that you need will be able to be found. And just thank you for engaging with our work today. Jasmine's going to throw our final slides. Our hope is that the work that this work is helpful to you in your effort to influence policy and improve health and well-being in our state. There are so many ways that you can be a part of that, providing data or analysis to a policymaker, giving legislative testimony, inviting a policymaker to your organization to meet with you. But we'd love to know what you thought about the webinar today. And if you plan on using this information to influence policy. There are 9 questions. Thank you so much for taking the time to complete our evaluation survey. You can scroll through those with the pop-up on your screen. We're also continuing to see some questions come into the box. We will save those and direct those. Nicole Kaler and Nicole Silliman after today's event. Thank you so much for being an engaged audience and for spending some time with us this afternoon. If you would like to connect with us at HPIO, you can go to hpio.net and click on the About Us tab. All our contact information is there, as well as a way to sign up for announcements of future resources and webinars coming from us. It is 2 o'clock, so with that, I'm going to say thank you for being with us this afternoon and enjoy the rest of your week. Thank you all.